Next year, at least 60,000 people are expected to be diagnosed with Parkinson's disease in the U.S. They will experience tremors, slowness of motion, and loss of movement on one side of the body. They may lose their sense of smell and suffer from motor abnormalities. And as time goes on, their symptoms will grow much worse. In this video, we're going to tell you what Parkinson's disease is, who it affects, and what symptoms they will develop. We'll show you some of the treatments for Parkinson's and disclose some of the great resources that are available for those who suffer from this illness.
Parkinson's disease is caused by problems in a particular part of the brain that's involved with motor activity, an area called the substantia nigra.
Parkinson's develops when certain cells in the substantia nigra are destroyed. These cells are responsible for sending fibers to gray and white bands of tissue in both sides of the brain, called corpus stratia. When these fibers are transmitted properly, the corpus stratia is able to release dopamine, an essential neurotransmitter or chemical messenger in the brain. Dopamine sends messages to cells all over the body, helping the body control nerves and muscles, respond to stress, and process information and memory. When someone is diagnosed with Parkinson's disease, the corpus stratia is no longer able to send dopamine. Fibrous lesions called Lewy bodies appear on the brain, and the patient is no longer able to control his or her muscles, movement, and balance.
Because we don't know what the primary cause is. We don't know why this production of dopamine stops. We don't know why these lesions develop in this particular area of the brain.
We may not understand why Parkinson's disease develops in patients, but we do know some details about who's affected. Most Parkinson's patients are diagnosed when they're in their late 50s, but about 10% of patients develop early onset Parkinson's, where symptoms manifest before the patient is 40 years old. Although Parkinson's is not strictly genetic, researchers have found some evidence that people with siblings or parents who develop Parkinson's may be more likely to have the disease themselves. The risk is much greater for the relatives of early onset Parkinson's patients than it is for families of elderly patients. There is also research that suggests that certain environmental factors, such as exposure to toxins and chemicals, also play a role in developing the disease. Parkinson's is not a contagious or fatal disease, but it is a progressive one, so a patient's symptoms will grow worse over time. These symptoms may include tremors, slowness of motion, intestinal motility, motor abnormalities in the hand, drops in blood pressure, changes in sensations of temperature, sleep disorders, speech difficulties, vision problems, dementia and paranoia, and depression.
People with Parkinson's disease have increasing difficulties taking care of themselves as the illness progresses because of the stiffness, because of the tremor.
For many elderly patients in particular, the unstable movement and balance problems inherent with Parkinson's can be very dangerous. Without equilibrium, patients can easily break bones or sustain injuries from falls. Parkinson's is also difficult to diagnose. There is no blood or laboratory testing for Parkinson's, and even a CAT scan or MRI in Parkinson's patients usually appear completely normal. The symptoms can often be confused with Alzheimer's and other diseases of the central nervous system. Though diagnosing Parkinson's can be difficult, early treatment may help slow progression of the disease, so it is important to watch for symptoms in yourself and the people in your life.
It is a slowly progressive disease that gets worse over time, and there's not much you can do to prevent that from happening, although there are medicines now that are quite effective at slowing the course of the illness.
If patients no longer respond to medication, they can consider a surgical treatment, such as deep brain stimulation, where an electric pulse generator sends pulses to specific regions of the brain, stimulating cells. Exercise also helps patients stay active, self-sufficient, and can improve balance and motion control. Physical therapy is essential, helping to maintain as much mobility and independence as possible. Every day, scientists are working towards finding new medications, new treatment, and even a cure for this debilitating illness. Coping with Parkinson's is hard, but it's important to remember that there are resources available. Organizations like the American Parkinson's Disease Association help new patients and new caregivers understand their illness and provide support and aid. The Parkinson's Disease Foundation and the National Parkinson Foundation organizes millions of dollars worth of donations to scientific study and educational programs for patients and offer phone and internet resources for patients who have questions or concerns. Parkinson's is a complicated, difficult illness that gravely affects patients and the people around them. However, with so many resources working hard to find new ways to cure or slow down the disease, there will always be hope for the future.